Hello, my name is Betty. If there's anything I can change in the healthcare system today, it would be the way insurance companies dictates which doctors the patient should see. I feel like the patient should have freedom to choose whoever the doctor they want to see. The um, the system is already overwhelmed as it is. So I feel like if they let the patient, if they let the patient choose whoever they want to see, will reduce this problem. Um, for example, if a patient have chronic issues like blood pressure, high blood pressure, um, they have to see the doctor regularly so that they can get prescription or get checked. So if they can get an appointment with the in-network doctors, this will create other issues because this patient can end up with other health issues associated with blood pressure, um, and they might end up in the emergency room or getting admitted in the hospital just because they didn't get the appointment on time with their in-network doctors. The changing nursing role in quality, patient outcome, and reimbursement. Um, with insurance companies, again, they have reduced the length of stay, and if a patient have hospital-acquired condition, the hospital will not get paid for it to treat that. Or if the patient get readmitted within 30 days of discharge, the hospital will not get reimbursed for that. So with the reduced length of stay, it will, like, most of the doctors don't admit patients until it's pretty necessary. So most of the time when the patient gets admitted, they are pretty sick. So the nurses have to be well equipped or have all the necessary supplies or knowledge to be able to handle this kind of patients. And to prevent readmissions, nurses have to teach the patients, provide patient teachings, of which that's another issue because by the time the patient is ready for to participate in patient teaching, they are already getting discharged, which is a problem. Type of nursing care delivery that should be implemented in 2020 should be both primary and team care nursing. This is because I feel like the team care nursing will be pretty important because you have the techs, you have the nurses, you have everybody else working together to provide care for the patient. So one person, nurse will not feel overwhelmed. At the same time, having primary care nursing, having primary nursing too, is pretty important because at least you have somebody who knows more about the patient for that patient's length of stay, which is really good. How would you prepare for it? I think most of the hospitals should provide training for most of the nurses to handle these pretty sick patients, because these patients are getting admitted when they are really, really sick. So the nurses have to be well trained. So the hospital have to provide training for that. And for new grads, I think the best way to do that, to train them well, is having them go through nursing residency. And I think another thing that would help is cross training for acute care nursing. I think they should cross train in critical care nursing so that if for some reason if they get somebody who's really sick, they would be able to handle that such patients. How would you evaluate for effectiveness of that of the nursing model that you've implemented? This is just by doing a patient survey and staff survey that would help. Thank you.